What do they do at pelvic floor physical therapy? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. This is a great question. You might be at home wondering, what do they actually do in pelvic floor physical therapy? Maybe you got an order from your doctor or you've been researching a little bit on Dr. Google and you're kind of curious on what we actually do in pelvic floor physical therapy. Maybe you have a diagnosis already and you're just kind of curious on what the next step is and what will actually happen inside a treatment room like this. So I'm going to speak to you about what we do here at the Healing Spot. So this is specific for our practice. So other places may have their own protocols or their own way of doing things, but I'm going to speak specifically on what we do here at the Healing Spot. So the short answer, it kind of just depends on what you need pelvic floor physical therapy for. So I'm answering a very general question and I'm going to try to be a little more specific. First off, I want to tell you about your pelvic floor. It has the functions of pee, poop, and sex. So if you are being bothered in any way or have concerns related to your bowel function, your bladder function, or sexual function, you are likely watching this video going, okay, I know I have a problem, but what do I do about it? So I want to dive a little deeper into specifically, again, people that we see here at the Healing Spot, why they reach out to us when they have issues related to pee, poop, and sex. I will say here at the Healing Spot, we can put our patients into three main categories. So one would be people reaching out to us during pregnancy. The other would be people reaching out to us after pregnancy, after having their babies, even if it's been years ago. And then the third category I would say would be more into maybe our chronic pain or even trauma. So I want to dive a little bit deeper into that. And I also want to say, even though here at the Healing Spot, we see a majority of people that are pregnant and postpartum, it's not the only clientele that we see. So if you're a woman at home and you've never had a baby, you don't plan to have babies, you may still have a pelvic floor concern that requires a specialist to look at things, give you an assessment, and come up with a treatment plan. Let's dive in a little bit deeper into each one of these categories and some specific diagnoses that you might have found on the internet or you might have been diagnosed with. The first category I'm going to talk about are our pregnant clients, the ones that reach out typically with pain of some kind. So it could be pain into the pubic symphysis in the front, it might be back pain, sacral pain, pain around the hips or the pelvic area. It might even be pelvic pain where they're noticing it with sexual intercourse. So I would say that's not everybody that reaches out that's pregnant that has pain, but it's pretty common. So that can be a sign of a pelvic floor dysfunction that's leading to some kind of pain around that whole pelvis. The second category with our pregnant patients, they're reaching out because they want to prepare for a certain birth experience. So they're being proactive. They may or may not already have some issues with their pelvic floor, but they're really trying to have a more natural childbirth. They want to be better prepared and be more empowered going into birth. So they're coming to us for that birth preparation. And another reason our pregnant patients reach out to us is because they are noticing changes with their pee, poop, or sexual function. So it might be things like they're starting to notice that they're having some urinary incontinence where they're leaking a little bit when they're coughing or sneezing or maybe working out. Maybe they're noticing some hemorrhoids or other changes with their bowel functions, maybe constipation or irritable bowel syndrome, but some kind of changes with the bowels themselves or changes with sexual function. So it might be pain. I would say that's probably the biggest reason people reach out if it's related to sexual function is because they are now having new pain when it comes to intercourse and it's concerning to them. The second category of people reaching out to us here at the Healing Spot for pelvic floor symptoms are related to postpartum symptoms. So again, like I said earlier, they might happen later in life or even years after their baby is born. I will say for the most part, people, I think it's not that it's new symptoms, like you have a baby and then 6 years later, you're like, oh my gosh, all of a sudden I'm having these symptoms. It's more like with our patients, they have the symptoms, something has changed after baby, and let's say 6 years later, they're still dealing with it. And they finally get to the point where they say, enough is enough. I want to get some help over this. So regardless of when it starts, If you've had a baby and you're noticing things like pain, so it could be pain anywhere along that pelvic girdle. So it might be pubic symphysis pain here in the front, it might be back pain, it might be sacral pain, hip pain, and it's really limiting how you can move around your house, how you might be able to work, how you're taking care of your kids, working out. It's somehow impacting you, and it's really giving you a lot of fear and also limiting your life. Another reason we have people reach out postpartum is because of diastasis. So that's the separation of the abdominal muscles. And a lot of women reach out because they're worried about how wide their gap is for the diastasis. They don't know what exercises they can do safely. They're worried about the appearance of what the diastasis looks like. They feel like they still look pregnant even though time has gone on. And it's really bothersome for them in their self image. So diastasis is definitely something that we see a lot of women for as well. Another reason women reach out because they've had some changes after baby could be related to prolapse symptoms. So this is a feeling of like heaviness or bulging. You might even notice some tissue, or you might notice that something's kind of feels, or you can see it right at the vaginal entrance, or you're noticing pressure into the vaginal area or the rectal area. And sometimes it gets worse as the day goes on. So some type of prolapse symptoms. And women are reaching out because they're not quite sure what it is, how to manage it. They're not sure what they can do as far as exercise or what's safe to do even around their house. So that's another reason that people reach out to us for pelvic floor symptoms. Incontinence of mainly the bladder, I would say. People reach out to us for help with pelvic floor. So that could be leaking, having accidental urinary leaks. So your bladder just doesn't feel like it's strong enough. Rather, the muscles don't feel like they're strong enough to hold things back like they're supposed to. So that could be urinary incontinence. I would say that's the most common, but we also see women that have fecal incontinence where they're smearing or they're noticing accidental loss of bowel movements. It could also be accidental loss of gas. So people that are passing gas and they don't really mean to. So again, we can go back to changes in the bowel or bladder function and also sexual function. So same goes we talked about with pregnancy. You can have lingering pain into the vaginal area with intercourse after having a baby. And if time isn't healing it, that's another reason to reach out and get some help with that. So let's explore the third category that I mentioned. Chronic pain, that can be, like I mentioned before, maybe you're a woman that just has pain of the back or pubic symphysis area or into your hips, and you have tried other things and it just hasn't resolved. So it may be after baby and it may not be. Maybe you're a woman that has not had kids and you still have pain into those areas. It's entirely possible. The other category that I kind of put with that is even trauma. So it might be birth trauma. After a traumatic birth, you might have some lingering pain or feeling like your pelvic floor just feels weak. It might be medical trauma in relation to pelvic floor exams or well woman exams. And it might even be sexual trauma. We see a fair number of women that have had a history of sexual trauma that's really impacting them in some way. Again, the common symptoms that we're going to see with that is any changes or concerns related to pee, poop, and sexual function. Now that you know more about the symptoms that pelvic floor dysfunction can cause or why you may need pelvic floor physical therapy, I want to answer the question that we first came to with this video of what do we actually do here? I want to talk specifically about the unique three-step process that we do here at the Healing Spot. Number one, we want to know more about what's going on. We want to hear your story. We want to know how long has this been bothering you and how is it impacting you on a day-to-day basis? What are your worries? What are your limitations? Things like that. So doing a phone consultation with us to let us hear what's going on and give you some reassurance that what you're experiencing is likely normal or something that can be fixed. Okay, so we first need to know what's going on so we can answer your questions and make it more customized for what you need to hear. The next step is to have you come in for an assessment and treatment. So what that looks like really is we have to find out what's going on and find some baseline information on, we'll look at your mobility, maybe your strength, how you're breathing, your posture, a lot of things that help us as physical therapists know what's the root cause of what is going on that's causing the concerns that you're having. So first we need to do that assessment and then we go right into treatment. So here at the Healing Spot, we do a lot of education. We get out our pelvic models, we get out illustrations, and we really explain to you what we're seeing and what we're feeling so that you know more about your body and why we are suggesting the treatment options that we will based on what we are actually finding that's relevant to you. Some of those treatment options can include manual physical therapy techniques. So it may be the physical therapist using their hands to gently relieve muscle tension, to bring alignment back to your pelvis, to get areas or joints that aren't moving really well, to get them moving better so that it can relieve your pain and start to bring better function back to the musculature of the pelvic floor. It can also look like exercise, maybe stretches if you're tight in particular areas, or strengthening exercises if you're weak. But again, we need to know that baseline information to know exactly what targeted exercises you need. Here at the Healing Spot, we use something called low pressure fitness. It's a very unique way of training the pelvic floor and core. It's great for pregnant and postpartum clients. It's great for women that have not had babies. It's really safe for a lot of the diagnoses and the concerns that I talked about earlier. There's a big reason why we teach that here at the Healing Spot, because we know it's effective, it works, and it's safe. We may do some traditional exercises as well. So that could include going down to our exercise room and using some small weights to do upper body strengthening, lower body, core strengthening, and really teaching you how to move properly so that it's going to take the strain off of your body and help you get the muscles of your core and pelvic floor working well again, and giving you that chance to actually practice with our guidance. Here at the Healing Spot, we also use radial shockwave therapy, and that can be a great way to boost healing. Or one of your issues is pain. It's very effective in helping the body heal and boost its natural healing properties as well as tissue regeneration. Another modality that we offer is dry needling, and that can help with muscular tension and help to activate muscles as well so they work properly. And the final thing that I will say as far as our treatment options is even just educating you. It's very important that you understand what's going on in your body, what can be done about it, and what you can do at home as well. So developing a home program, whether that be exercise or lifestyle modifications, so you know exactly what you can do to complement what we're doing here. And it can really make you feel a lot more empowered about the condition that you're experiencing. So that brings me to our final step in this unique process that we use here at the Healing Spot. It really is getting to the root cause of what's going on, treating it so that it doesn't come back again. And that's treating it in a very holistic way. Instead of just, telling you, you know what, you probably have weak pelvic floor muscles and you need to do a bunch of Kegels. We go beyond the Kegels, okay? So what's the next step here? If you have gotten to the end of this video and you're wondering, how do I get started? How can I get the help here? What you can do is head to our website, healingspotpt.com, and pick whatever option works out the best for you. You can request a discovery session with one of our therapists, and we would be happy to sit down with you and listen to your story and also answer any questions that you have and really explain how we can help you based on the details of what you're currently experiencing. We would be honored if you reached out to us here and let us be part of your healthcare team to help you feel better, more confident, and pain-free again. Thank you so much for watching this Ed Talk. We'll see you on the next one.